Hello, doctor and medical students. I am Dr. Amit. So we'll move forward in our hemorrhage discussions. In the last two slides, we discussed about classification of hemorrhage and pathophysiology of hemorrhage. Now today we'll move forward and we'll talk about the clinical feature of hemorrhage in a patient. So in any patient with hemorrhage, you can look for the pallor. You can look for the pallor in the patient. You can look for the thrust in the patient. So how much the patient is thirsty. After then you can look for the cyanosis. Okay, cyanosis in the patient. Then you can look for the tachycardia. Then the patient with hemorrhage will present with air hunger. The patient will present with tachypnea. The respiratory rate will be high. After then the patient will have a cold clammy skin. After then the mouth will be dry, the face will be dry. After then there will be good skin appearance in the patient. Then there will be rapid thready pulse. The patient will have hypotension and the patient will have reduced urine output, that is oliguria. Now let's talk about what are the signs of significant blood loss. Okay, so if in any patient, if the pulse rate is more than 100 per minute, then it's a sign of significant blood loss. Then if the systolic BP of the patient is less than 100 mm of Hg, then that's a sign of significant blood loss. Then there will be orthostatic drop, that is the BP will be more than 10 mm of Hg. The drop in the PP will be more than 10 mm of Hg in the sitting and standing positions. Then there will be pallor in the patient. Then you can see sweating in the patient. Then the shock index, that is the shock index will be increased, that is heart rate by systolic blood pressure will be more than 1 in case of significant blood loss. So these are the signs of significant blood loss. Now we'll talk about how to measure the blood loss. So if the clot size, if the clot size is as per the size of a clenched fist, then this clenched fist is equal to 500 ml of blood loss. Then in case of closed tibial fracture, the blood loss will be 500 to 1500 ml. Then in case of femur fracture, it will be around 500 to 2000 ml blood loss. Then there is a swab weight method. So it is an important intraoperative tool to measure the blood loss. So in this method, so the blood loss will be wet swab weight minus dry swab weight into 1.5, sorry. So in this method we will take the wet swab weight, after then the dry swab weight, and we'll multiply with 1.5. That will be equal to the blood loss. Now we'll move forward and we'll talk about the classification of hemorrhage. So there is a ATLS classification of hemorrhage. Most of the time, most of the MCQs ask from this ATLS classifications. So there are 4 classes: class 1, class 2, class 3 and class 4, and we'll talk about each classes one by one. So while talking about class 1, in class 1 there will be less than 15% blood loss. It means there will be less than 750 ml of blood loss. So in this patient, the heart rate will be less than 100 per minute. After then the respiratory rate will be 14 to 20 per minute. After then the urine output will be more than 30 ml per hour. The patient will be in mild anxiety. And while talking about the treatment part, blood transfusion is usually not needed, and if needed, then we will give crystalloid to the patient. Now let's talk about ATLS class 2. Okay, in these cases there will be 50 to 30% of blood loss. It means that the blood loss will be around 750 to 1500 ml. The patient of this group will have heart rate between 100 to 120 per minute. The respiratory rate will be around 20 to 30 per minute. After then the urine output will be around 20 to 30 ml per hour. The patient will be in mild anxiety, and in this group of patients, the treatment required crystalloid, and we can say plus minus blood if the bleeding continues. Then while talking about the class 3 of ATLS classifications, in this patient the blood loss will be 30 to 40%. After then the heart rate of the patient will be 120 to 140 per minute. The respiratory rate will be 30 to 40 per minute. After then the urine output will be 5 to 15 ml per hour. The patient will be in the anxious state and confused state, and treatment required blood transfusion, and a definitive resuscitation is needed in patient of this class. Then the class 4 of ATLS classification include those patients in which there will be the blood loss will be more than 40%. The heart rate will be more than 140 per minute. The respiratory rate will be more than 35 per minute. After then there will be minimal urine output, or we can say that absent urine output. Okay, the patient will be in lethargic state, in coma state, and this patient for treatment of this patient we need massive transfusions plus urgent surgical protocol is needed in patient of this class. So that was about the 4 ATLS classifications of hemorrhage. Now we'll talk about effect of hemorrhage on our body. So while talking about the effect on our body, there will be acute renal shutdown. Okay, so it means that there will be acute kidney injury in the patient if the hemorrhage will occur. Then there will be liver cell dysfunction. Then there will be cardiac depression. After then the tissue will be in hypoxic state. There will be low oxygen in the tissue, so the tissue will shift to anaerobic metabolism. Then that will cause increase lactic acid in the tissue, that will lead to metabolic acidosis. Then because of low blood supply to the gastrointestinal tissues, there will be gastrointestinal mucosal ischemia. Then there will be increased risk of sepsis. After then there will be interstitial edema, and this all will finally lead to MODS, that is multi-organ dysfunction syndrome in the patient. So this is all about hemorrhage today. In the next lecture we'll talk about treatment of hemorrhage in a couple of minutes. Thank you for watching, and if you like this video, please subscribe my YouTube channel at the Dr. Amit Official. Thank you.